Let us begin the meeting for September 22nd with our massive mallet and ring the bell to start the meeting.
Wow.
So, Joe, our invocation for today, we are going to start spreading this around so more people can do invocations. Joe, you have been amazing, and I love your invocations. So please do not stop wanting to give invocations. Really, really, really thank you very, very much. Go ahead. Let's do the invocation for today.
Thank you. Thank you. Let us pray if you're so inclined. Dear God, we pray for our churches, our workplaces, our schools, and our communities. We ask for your help in being a light in every place you've given us to walk. Give us care and wisdom as we live and work with one another. Help us to look at another's needs before our own and to always be ready to serve those around us by the power of your love within us. Even in every dark and broken place, for the times we feel like we're barely making it through, give us your joy, your grace, and your powerful presence. We pray that all those in authority, all our leaders around our nation, that they be given wisdom and discernment. We pray that their hearts would be directed first to you. We ask that you guard their coming and their going, that you would be their refuge and their peace. We pray that you would surround every leader with wise counsel, and that they would be humble and through their actions and words. Amen.
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 Thank you very, very much, Joe.
Good.
My pleasure.
Let's see. Oh yeah, Alex, would you lead our Pledge of Allegiance?
Can you hear me?
Yes, we can.
Okay, because my video camera is not working. I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Excellent. Thank you. Christy, did you actually stand up for that? Very nice. All right, our patriotic song.
I love that.
That was amazing, wasn't it?
I was
What I can find out.
bravo.
So welcome to our September 22nd Zoom meeting. By the way, for those who did not know, this last Sunday was Talk Like a Pirate Day. Apparently they're making a movie and it's going to be rated R.
Well done, Andrew.
Thank you. You know what they say, if I was half as funny as I thought I was, I'd still be twice as funny as I actually am. But,
Aussie, don't laugh. You'll just encourage him.
right.
Andrew,
That's the truth.
So let's see. Yes, sir.
Andrew, do you know
Yes.
how much it costs to have a pirate get his ears pierced?
No.
A buccaneer.
Oh, I saw that coming just as you brought it in. Okay.
Too late. Yeah.
Oh my God, the dad jokes reign.
Right. So I saw a couple of our regular members joining us. Joe Stanford, while we were out listening to music. We have John Steele. We have Bob Schuster has joined us, and want to welcome them. But also our guests, Lynn Bauer. Mike,
Yeah, Lynn's a local realtor, 3 children, high school, I believe, and she's interested in joining our club.
outstanding. Welcome, Lynn. Let's see, who else do we have here as a guest besides our speaker? Miss Christy. And all right, are there any other guests besides Christy and Kristin? Oh, Suzanne Southwell. Yes.
Hi, Suzanne.
Do you count as a
Hi,
visiting?
Rosa. Happy birthday.
You count as a visiting
Thank you.
Rotarian, right?
Yes.
And does Kristen still count as? Are you still, Kristen, still part of the Encinitas Club?
Of course, for life.
All right. So welcome to our visiting Rotarians and our guests. And this should, other than Christy's the only one of our guests who hasn't heard this yet. So our howdy song.
Howdy, we're glad to have you here. Welcome. We sing a loud and clear. Relax, enjoy the program, and won't you come back to see us again?
Yay. Oh, iPad 4 has entered the room. So let's see. Our calendar coming up. Next week, American Rugby, brought to us by Dr. Moyer. On the 6th, we have Blair Lee talking about climate change. On the 7th is a Haven House. On the 13th is a board meeting. The 13th, we will also have Joanne Axelrod. The 13th was supposed to be our demotion dinner for Jan. But we have come up against some logistical issues, so we have a backup plan with Joanne Axelrod. Demotion will probably be in January at this point. The 20th, we have Money Made Easy. Another Haven House on the 21st. On the 27th, we're going to have a tribute program. And on the 3rd, Solutions for Change will be presenting. Member moments. There are no member moments that I know of yet, other than Rosa Rees is celebrating her birthday on a beach and thanking everyone for the birthday wishes. We have another announcement about membership later, but that will be coming up. So we have our In the Wild, and here's Mr. Ken Myers with his granddaughter at Kit Carson Park. And honestly, probably a better driver than Ken at this point, I'm assuming.
The caption is, what do you mean I can't park here?
Nice.
That's Autumn with her Jaguar.
Autumn with her Jaguar. Here we have Kurt Beyer. I actually did not get the story on this. Christine is out sick today. Just a little scratchy throat. But Kurt, you want to tell us a little bit about this story? Maybe.
Can you guys hear me?
There you are.
Can you hear me?
Yes.
Yes.
Oh, sorry. Well, normally I go camping through the YMCA with the dads and daughters, but since that has been canceled this year because of large groups, me and a couple of my friends take our daughters camping. So we decided we were supposed to go up north to the Sierra area, but since all the fires are up there, we decided to go to Arizona. So we spent 2 nights in Sedona and 2 nights outside of the Grand Canyon camping. And then we all have 4-wheel drive trucks and 4Runners. So we did a lot of 4 running, off-road. We went up to right outside the Grand Canyon, Flagstaff. There is a couple mountains up there, and all through Sedona by Snoopy and some of those rock formations that they have over there. It's pretty fun.
I hear you filled in the meteorite crater.
Yeah, it's not the meteorite crater. It's can't think of the name right now.
Just east of Flagstaff. It used to be until you filled it in.
Yeah, it was in Flagstaff. Can't remember. It starts with a C, I believe, Cahill maybe or something. And it was the rock formations, the lava rock formations up there, and we got to go all the way up to the top of the crater. 2 of us had issues getting up there, but we finally were able to get up there as long as we had a fast running start with our trucks, and we made it up there and had lunch up there and enjoyed it.
Very nice.
Yeah.
Here we have Arlene visiting with one of our members down in La Jolla. Had a nice lunch. Unfortunately, I don't have my notes on this one because I was not expecting to be presenting this, but looking fit and healthy and happy and glad to see Arlene, which of course we all are glad to see Arlene when she comes around, right?
And Pat Reno.
Yes, Pat Reno. I'm sorry. Again, I'm not reading from notes, and I forgot that I didn't say her name. I had her name in mind, and
Yeah, Pat looks awesome.
she looks great. I just am all flustered here. Sorry. I've given this up to somebody else, and now I'm having to do it again. Oh, Vate Campbell celebrated her daughter's 15th birthday. Hard to believe how fast they grow up, isn't it? And Paulette has been out in the desert. Apparently she's been talking with Keith Moon. Oh, there we go, dogs. She's been talking with Keith Moon, asking, who are you?
R.
All right. Here we are, our service spotlight for this 22nd of September. Gloria and Frank Teka. And they have a few things they want to tell us. So please, Gloria.
Okay, thank you. First thing I wanted to say was I have made the best friends of all of my life with the members of the Escondido Rotary Club. And I think that was due mostly because I was the director of the community service for so many years. I never had trouble getting committee members for our grants and for any of our service projects. Even when I asked for their blood, people would volunteer and go down to the blood bank. For those of you that are new to the club, we had a blood drive every Halloween. Also, I think one of the most rewarding, well, they were all rewarding, all the service projects. One year we did 21 service projects, but the Salvation Army bell ringing, I did not think that was my thing. But in doing that, I heard so many wonderful stories about people that had gone to the Salvation Army, and they would come and tell me how the Salvation Army turned their life around. Also, they gave us thanks to the Rotary because Rotary had helped them in some way. So anytime you do a service project, it's really very heartwarming to hear the comments. We collected food for the military. We did so many different service projects, and it's all so worthwhile. Frank and I both worked on Coeur de Cuisine from the very first year. We had to give it up these last couple of years because of my health problems. But in knowing how hard the whole club worked to make a successful Coeur de Cuisine, I felt it was my obligation, as well as the committees, to make sure all that grant money went where they said it was. So I visited almost all of the grant recipients and checked them out to make sure our money was going where they said it was. I truly believe Escondido Rotary is making a wonderful difference in our community, and I thank you for the opportunity to be part of it. You have something to say?
We're talking about the past, right?
Yes, yes, yes.
A little bit.
Probably the most fun I've had in all of Rotary is when I wrote and produced the Western Shootout, where Gary Seitel was Black Bart and Kim Fleming was the town drunk and Karaskaya was the judge. And, you know, we put that shootout on for the dinners for the governors when they all came to San Diego. We put it on twice indoors and once outdoors, and it became so popular that the district asked us to put it on at the district meeting at the Lazy Creek Ranch. So that was just so much fun. And of course, everything we do, you know, we have fun. All the people are so great, and it's Rotary's quite a fantastic community.
So let's talk about the future a little bit.
Well, Frank has already looked into all the Rotary clubs up north. So we're going to be in Washington State, Woodland, Washington. So he's looked up the Rotary clubs, and as soon as we can get up there, we're going to visit, see if there's anything compared to the Escondido Rotary Club.
Yeah, Woodland Rotary has 68 members, so it's about half of the size of ours. Vancouver Rotary has like 160 members, so it's really big, but that's a little too far away. But you know, that's the best way to meet people and find out all about the town and, you know, get involved. So that, and then our Corvette clubs, of course, you know, so we'll fit in pretty good and pretty fast. So we're looking forward to it.
Well, thank you. And again, for those who haven't been caught up, Gloria and Frank are moving from our lovely town to Washington State. This is their last meeting. We are going to miss you very, very much. And I'm a fairly new member, but I got to say, Gloria, when I drove down with you to that one training, I got to know you better than I had before, and you are an absolutely charming, wonderful, amazing, brilliant person that I wished I'd had more years to get to know you better, because I know it just scratched the surface of who you are, and I was impressed more than I can say. And I'm going to miss the opportunity to get to know you both better. I've only had 3 years, and a lot of that I've been distracted. So maybe I'll come up and visit one of these days, if you're willing to admit that you know me.
Yeah.
In your new town. Anyhow, from the entire club, let's all give Gloria and Frank a big, big hug and lots of love and safe travels to Washington State.
They are going to miss you.
We are.
Miss you too.
Andy, you said Gloria was brilliant. Her nickname is Brains.
Right? Right?
Right.
So see, I wasn't even on the nickname committee, and they recognize it too.
Yeah.
Oh, all right. Well, on that note, let's, I hate to move on. I don't want to move on, but we have to, I guess, right? That is the story of life, is having to move on. Let's see, got to let Fred back in here real quick. Oh, Ron Parker. Look at that picture of Ron Parker playing on a playground that's been shut down. Ron, do you want to say anything about this real quick, or do you just want me to run on it?
No, this is the one that we helped Kiwanis construct up at Lake Dixon. And Lake Dixon, I don't know how many thousand acres that whole complex is, but this is only the second playground up there, so it's quite important. The dedication will be shortly.
Yeah, and so as I understood the email, the city has actually taken over the ownership of it now. Is that correct?
I can't answer that, sir.
Oh, okay, it's all good. The project is essentially complete. It's just waiting for an opportunity to actually have the ceremony. Correct?
Yes, sir.
Okay. Beautiful. It's good work. Congratulations to our club. Thank you to the Kiwanis Club for leading us on that, or leading the project, and thank you to them for allowing us to join them in sponsoring it. All right. Chirito, you want to talk about your word for the week?
Oh, I'm sorry. I didn't get the chance to. I can't even pronounce it, so I won't today. But we are all living under a rock right now.
Okay, Saxicolis. Saxicolis. See, I thought Saxicolis was a musical term. Maybe just
Right.
better. You know what they say? Drugs, Saxicolis, and rock and roll.
Back to Pirates, Andrew.
What was that? Back to Pirates. So our fun song, again, Christine was going to sing our fun song. She has volunteered a new person to sing for us. So I give you Jay Grossman.
So are you gonna, will you mute everybody, Andrew?
What's that?
Will you mute everybody, please?
Yes, I will. Let me.
You ready? All right, I just got this morning. This is to a Yankee Doodle dandy, okay? Chairs the Board of Supervisors, Kristin Gaspar, young true, a real live granddaughter of Uncle Stan, salutes the red, white, and blue. She was the mayor of Encinitas, on the city council too. Was president of Encinitas Rotary, service above self ×2. Attended Arizona State U, journalism her degree. A mom to 3 and wife to husband Paul. Busy, that's easy to see. We're fortunate to have her with us and hear all she has to say. Kristin Gaspar, supervisor, came to Escondido. We're glad to have her here today.
Great.
Wow, that was very good, Jay. And I thought I had everyone muted, and then I
did not.
It was, yeah. Anyhow, brilliant. You did a brilliant job.
Okay.
Mayor McNamara, would you like to introduce our program speaker, Kristin Gaspar?
I would. Thank you, President Andrew. And for most of the members here, Supervisor Gaspar is no stranger. She's been to our club before. She's been very active in Escondido. And I like to think that we all know her and know all the good work that she's done for us. But for those of you who might be new, I think there's a few highlights that should be pointed out in her bio. One is that Kristin is a fiscal watchdog, okay? I think she's really worked very, very hard in terms of working with Sandag to make sure that Sandag fulfills its promises to North and East County. You would also know that as Kristin as a businesswoman, really understands what a profit and loss sheet is. And I think that's very important, that because a lot of politicians don't know that there is no such thing as a free lunch. And being a businesswoman, I think, brings a lot of credibility to her to her role as a supervisor. The other thing that I would want to point out is that, and a lot of people don't know this, is that the driving force behind the homelessness issue in the county is Supervisor Gaspar. And quietly behind the scenes, she has worked to unite all the cities, especially here in North County, to work together to try to not just address the homeless issue, but solve it. And I feel very privileged to be able to work with her and help her execute that plan. And as many of you know, for those of you who have been involved with homelessness, it's not a trivial task. It's very complex. It's hard to solve, and that's why most people don't solve it. They just complain about it, or they don't try to take it on. But that's one of the things that I really like about Kristin, is that she's not afraid to stand up for what is right. She's not afraid to take on hard problems, and she's not afraid to suffer the consequences of the Facebook warriors who love to complain but not do anything. So with that, and without further ado, I'd like you to introduce our supervisor, Kristin Gaspar.
Well, thank you, Mayor Mack, and I must say that it really has been a privilege and an honor to work with you in elected office. I'm so proud of you. Anytime I come up with a new, innovative idea, I bring it to Mayor Mack, and he always says, bring it here to Escondido, and that truly has been a blessing. So thank you, Mayor, for the wonderful introduction, and most importantly, the work that we're doing together to help the citizens of Escondido. Good afternoon, Escondido Rotary. I feel like I'm cheating on you a little bit. I started my day with RB Sunrise Rotary, but this is round 2. Thank you for the opportunity to address you today. Top of mind for most people is what? The pandemic. Want to catch you up to speed with where we are. Also wanted to take a little bit of a look back at where we've been. There are some things that you might not be aware of, and for the very first time, we've gotten a very holistic view of the impacts back to San Diego that you should be aware of. I think as Rotarians, we can solve anything. If we can solve polio, we can solve this pandemic too. We can come together as a community and come out of this stronger and more resilient than ever, but boy, am I going to need your help. So let's think way back, 192 days ago, if you can believe it, that is when our pandemic response started here in San Diego. Now, very early on, if you can remember, the name of the game was not overwhelming our hospital system. So right away, I got to work on several creative projects. We knew that we had the collaboration of 22 area hospitals. And I can't stress enough that our hospital system helps support us and keep San Diego where it is today in the clear without overwhelming the hospital system. They did things a little bit differently. We took lessons learned from places like New York, for example, where the governor there said, if only our healthcare system had flexed and operated as one, we would have been in better shape. So right away, early on, you saw the instant collaboration between all 22 area hospitals. They were keeping track of their PPE supplies. We were helping them as a county supplement those supplies when they ran low. They were talking about their workforce needs and the need to create a registry of workers should the need arise. Everything that you can imagine, including capacity of one hospital over another. And so anytime you get a chance to thank our hospitals on the local level, please do. That was important. But we also needed to prepare for any surges in the pandemic as well. I took part in a couple creative projects. The first one was with UCSD. Now, if you can recall, we sent the college kids home. And as a result, we had a number of unoccupied student housing units. We were able to partner with UCSD there, and thanks to the generosity of our community, quickly stand up 350 beds outside of the traditional hospital system. Now, these beds were intended for lower level cases or people that might be on the tail end of their recovery, but nonetheless, those who needed care. And on site there, we had the ability to house the doctors and nurses that would be caring for those patients. So we set up 350 beds there at UCSD pretty quickly. Here's the great news. We actually ended up shutting that facility down several weeks back. Not a single head ever hit a pillow in that facility. And that really is a compliment to our community, our response, and of course, the collaborative team we have, our clinical leadership. But we didn't stop there. We built the capacity at UCSD and then turned our attention to some help from the federal government. They were able to send us a federal medical station. Now what this is 250 beds that come complete with all the supplies that you would need to treat a patient. We just had one small problem, and that was the space to set up these 250 beds. But that was quickly solved too, thanks to the collaboration that exists in San Diego. It turns out that Palomar Medical Center had 2 empty floors, so just shell space, and it was the perfect space for us to quickly assemble this hospital within a hospital concept, adding another 250 beds to our medical system. So those 2 projects alone gave us hundreds of beds. The wonderful thing to know is that we have not filled a single bed at the federal medical station either. Again, we've been able to manage our hospital capacity quite well. From that point, now that we had surge beds built, I quickly turned my attention to the small business community. For those who know me, I've owned a small business with my husband for several decades, and we were in the same situation that most of our small business owners were in. Number one, we were really scared. We have 150 employees that we needed to protect during this pandemic, but it becomes a cash on hand game, and it's a really scary one to play because you wonder, how are you going to keep people on payroll? How long can you cover their medical insurance benefits? And these were the challenges that all of our businesses were facing. So I quickly learned about all of the relief measures that were out there. And then I did a lot of Zoom sessions with the business community so that they were prepared and applying for relief in the right places. The next step was preparing our business community for safely reopening. It was really unclear at that point in time when our businesses would be able to open up. But what was clear is that life had changed a bit and they wouldn't open their doors the traditional way. And it was up to people like me to help assist them. So business after business, I worked with them either on site or through the office, through Zoom. We talked about their unique business needs. We talked about what a safe reopening plan would look like, and we got those in place. And we got by business sectors in place safety plans and protocols that we sent to our CAO and then also to the governor and our public health officer. That helped prepare the business community so that when we were given the green light by the governor's office and by our public health officer, these businesses wouldn't waste any time being prepared to safely open. If you own a small business, I want you to know, or any business, how proud I am of you. I know that we've all gone to extreme measures to make sure that we were prepared and that we were protecting the community at the same time. These are very costly things to do. It's unlikely that your business has returned back to normal, and I understand that. I have an essential business that's been open throughout the pandemic, but even an essential business is likely taking a significant hit, and they're not where they should be. So the longer this pandemic stretches out, the harder it becomes. That cash on hand game becomes a little bit scarier. And if you think about the impacts back to the workforce, that's exactly what we're seeing now. So I'll get to that in just a moment. I also want to share as a mom, you know, we have a tendency on social media to make our lives look really glamorous. My life isn't really that way. In fact, I post a lot of funny pictures too of what it really looks like in my household, but I've got the difficult teenagers right now. And nobody warned me about teens. They're difficult anyway, but during a pandemic, it's been really challenging. And the thought that quickly our parents are transitioning to homeschool teachers, and I, for one, am not talented in this regard. And my husband and I are working. So there's a real strain felt by all of our families, not to mention what I see in my kids' eyes. It's really difficult to watch. I've got to tell you that I feel as though my own kids are rotting in front of technology. And it's hard to see day in and day out. And they're doing the best they can, but these kids are really struggling. So I've supported a real hybrid return to our school system. We do need to acknowledge that there are a lot of kiddos that aren't appropriate to go back quite yet. They might be in that high risk category. They might be living at home with someone or living in a multi-generational household. It would be inappropriate to send those kids back today. There are also situations with our teachers and our workforce that need to be considered. Sometimes our teachers aren't able to be back in the classroom just yet. But I fully believe that those teachers can be connected with the kids who aren't quite ready for that classroom setting. And really during this pandemic period, we have to be as flexible as possible and meet people where they are. I want to talk a little bit about the impacts back to our community, because early on it was about epidemiologists, it was about a response just to the virus itself, which was very dangerous and something that we needed to pay careful attention to. Now, over time, there were other impacts. So for example, for the first time at our board meeting, we had a comprehensive panel, and we drew people from the medical community to talk about what they're seeing in the emergency rooms, what they're seeing with mental health concerns, substance abuse, and the results were quite stunning. Number one, the economic impact back to San Diego. Now, experts are saying that it's unlikely that San Diego will recover until the year 2026. Think about that, 2026. It sounds so distant at this point in time. Prior to the pandemic, we really had a resilient economy, and we did okay even during times of recession. It was built on innovation, it was built on the military, it was built on tourism. But our economy here locally is not pandemic proof, and that's essentially changed the landscape for a number of San Diegans. At this point in time, 250,000 San Diegans are unemployed, and this is not the high for unemployment in this region. But remarkably, it's twice as many people unemployed as if you compared it to all of the years of the Great Recession combined, just a massive number. That's translated to 1 million San Diegans now in our safety net programs. And close to 1 million people, 900,000 San Diegans, have absolutely no idea where their next meal is coming from. Now, it's not surprising that there's been a tripling effect on depression, and at the same time, a 500% increase to severe depression that we're seeing with the patient population. At the same time, there are a lot of kiddos in very dangerous home environments. Calls to our child abuse hotline and our abuse hotline are down 50%, which on the face of it, you might think is a good thing, but it's a really bad thing because these kids are out of sight, out of mind. The typical eyes that would be on them would be their teachers, their doctors, their coaches, and these kids are not out front and center. In fact, Rady Children's reported that the emergency room there saw more extreme child abuse cases in the first 3 months of this pandemic than they saw in all of 2019 combined. Significant challenges there. When we talk about substance abuse, it's also pretty alarming what we're seeing. We've tripled the number of deadly fentanyl deaths over this pandemic period as compared to all of 2019. 2 weeks ago, I honored the lives of those who lost theirs due to overdose. Outside on the county lawn, we put the names of those who lost their lives to overdose. We put the drug that they passed from. 645 lost souls in San Diego, and placards behind me on the lawn. It's really quite stunning. The stakes are very high. The main disagreement I ever had with our public health officer is when she said that we were all asked to make a minor sacrifice. And I think it was a bit of a slip up because this is no minor sacrifice. And I do want to thank our community because our community really has stepped up to an enormous challenge. And so when we have this mantra that we're all in this together, we're indeed all experiencing this together. But please know that people are experiencing this in very different ways, and we need to be respectful and mindful of that. The fact is, we've learned a lot about this pandemic over the past 6 months. We've learned about who is in the more vulnerable population. We've learned about the need to really protect those individuals. And we need to apply that knowledge. We need to apply our local data to inform our decisions. Now, today was an important day. I was calling it the gender reveal because the governor was going to announce what tier we were in, whether it be red, whether we're taking a step back in purple. I'm sure you're well aware of the headlines with San Diego State University returning. Please know not a single case from SDSU involved on-campus activities. In fact, that campus hasn't been open other than some real specialty lab classes. These are kids coming from around the world into an dorm environment, a frat house environment, many of them out of the house for the first time in their lives. And guess what? College kids are very social, and they were. And that's led to a significant problem at SDSU with, by the time we're done, probably 1,000 extra cases piling on our numbers. The problem with us treating these as cases just like all the others is that the management has been very, very good with SDSU and the student population there. In fact, only 10 cases have gone outside of that university housing into the broader community, which is a testament to those efforts. At the same time, we know this is a young demographic, and this demographic is unlikely, based on what we've learned over the past 6 months, to translate into hospitalized cases. And if we think about the goal not to overwhelm that hospital system, it's unlikely that SDSU kids will do that. So as a county, we've been united as a board in asking the state of California to recognize those SDSU cases as a special case, a special circumstance, and not shut down our entire economy as a result. We got good news today that even with the SDSU cases factored in, we managed to stay in our current tier of reopening. However, there's still much work to do because UCSD kids went back yesterday to on-campus living. Cal State kids are returning to on-campus too. It's just a matter of time before something else comes up like this. You have a public health officer that's been advocating on behalf of San Diego. They've really tried to make the case to the state of California that, look, this is a big state. It's very diverse. And we understand you wanting to move us all as one giant state, but at the same time, doing so doesn't really address the underlying dynamics of each county. San Diego is a big county, actually #2 in the state of California, the 5th largest county in the country. And we want a responsible way to look at our metrics and be very flexible in how we make changes to our local protocols based on what we're seeing with our local data. We're not alone in asking for more reasonable metrics that fit large urban counties. We're joined by several others through our California State Association. We have the large urban counties of Riverside and San Bernardino and Orange, for example, joining us in asking for local control over the pandemic response and the ability for us to really flex on the spot based on what we're seeing in our local data. So that's a little wrap up of where we are today. We have a long way to go, make no mistake of that, but this is where we can really use your help because government isn't going to solve these significant challenges. You think about San Diego and all we were facing pre-pandemic, this is just an extra layer, an extra tier that we have to really dig deep, come together as a community and fight beyond. And I do believe that we can do it, but it's going to take help and volunteerism. As a Rotarian, if you haven't seen someone in a while, please try to connect with them. There are a lot of people that are having a really difficult time right now, and a phone call or a text might go a long way. Please look out for the kids in your community. If you're a coach like me, think about your roster. Think about who you might be able to reach out to and just do a little bit of a check-in. One thing I know, San Diegans, we can get through difficult times and we have the ability to come together, but now that's needed more than ever. What's also needed is me to stop talking at you so I can reserve some time for questions. And again, thank you for the opportunity to address you today, and hang in there. These are really challenging times.
Oh, hey, all right, there we are. That was, I was expecting a little more time. Thank you very much,
Time
Kristin.
flies.
Are you able to
excellent.
take some questions? Are you able to take some questions?
I can take a few, yes. Just a heads up, I am due on another Zoom here shortly in 10 minutes.
Okay,
We have
perfect.
this tight Zoom schedule.
Right.
As a elected official, I have no privacy, so you can reach out to me anytime.
All right. Does anyone have any questions for Kristin? Yes, Fred.
Hi, Kristin.
Oh, hi. I missed you, Fred.
Thank you. Tell me your thoughts about mask enforcement.
Mask enforcement? Well, the cities are doing most of the mask enforcement. Some of our municipalities have been stricter with the enforcement standards than others. For the most part, the county will manage the unincorporated areas, but the individual municipalities have elected in some instances to have tougher enforcement. I know some of our coastal cities decided to put more money into law enforcement for more mask enforcement. I see individuals out on our beaches, for example.
Right.
The county itself doesn't really manage that facial covering except in the unincorporated areas of San Diego.
There's some real inconsistencies around the county.
That's why, because you have the individual municipalities with their ability to have that local control. So it's tough because we also have tourists that come in too, right? So they're not aware of what our policies may or may not be. And then I look kind of silly sometimes too, knowing the full protocols. So I know when you go visit the beach, you got to have that on as you're walking in, but people look at you strangely because it seems like nobody else is doing that. So it is very inconsistent. I agree with you, and a whole lot confusing.
Thank you.
Any other questions?
Yeah, I have a question. Hi, Kristin. This is my name's Roy Henderson.
Hi, Roy.
There's a news story. Supervisor Jim Desmond has got an Open Now petition going. Can you tell me what that's about?
I'm not sure about the petition. I think it started with the business community. Their thought was we just need to reopen, and the standard ought to be that the businesses can safely reopen. The reason why I caution against this is that it doesn't remove the threat of enforcement from the state. The state has enforcement going on already active in San Diego. So for example, they have strike teams and they're working with the ABC. If they go out and they visit a restaurant that isn't following the current protocols as outlined by the governor of the state of California, they can yank the liquor license for that establishment. That's a huge threat for a restaurant, and it's happened in this state. So even if the county looked the other way and said, we're not going to enforce this, the state still can. I'd like to remove that threat from the restaurant community. Same with professional licensure. So in my business, my physical therapists are licensed through the state of California. In a hair salon, you have people licensed through California State Cosmetology Board as well. If these businesses were not acting per protocol as outlined by the state, they could revoke the professional licenses there. That's a heavy threat to put against a business owner, that uncertainty. So what I was trying to do was figure out a way that we can regain our local control and thereby minimize and remove those risks. The Open Now group, I believe, is built of business owners who are rightfully frustrated with the mass closures of entire business sectors, not really relating back to our local data. And I think that it's really important that we have local control and that we also figure out a way how to reduce those threats to our business community.
Anyone else have a question at this point?
I've lulled you all to sleep.
Not at all. Not at all. Not at all. I will follow up Roy's question a little bit in your answer. My wife is an esthetician, and
oh, yes.
it's very challenging. All weekend we were stressing what's going to happen on Tuesday. But one of the things that I find challenging is by letting localities determine who's going to be able to open and who's not, who's going to enforce masks and who's not. You know, if a client of hers comes from Imperial Beach and they say in Imperial Beach you don't need to wear a mask, and now she's coming in to my wife's business at a higher risk. So is there not a point where a consistent, at least at the county level, a consistent enforcement of the most effective method we have of preventing spread right now being enforced?
I don't know if we have the legal authority to do it, and it brings up a good question, and I could find out for sure. But as it was explained to me, we didn't have the legal authority to do that, and that the municipalities, for example, did have some local control, hyper-local control with their own cities. But I can find out for you, and I know it's challenging. It puts business owners in a bad place too. If you are the bad guy that's telling someone that they have to do something in a different way, we're in that position a lot with our business too. So I hear what you have to say, and I know your wife's been through a lot, especially with her business being closed. And it's sad with some of these businesses because they've always been very sanitary environments, less exposure. And it's been tough to watch closures of entire sectors that on the local level, I don't know that we have any reports of a case coming from an esthetician's office, for example.
Right.
All right, I love you all. I've got to run. Thank you for the opportunity today. Mayor Mack, we'll talk soon.
Thank you very much.
Have a boring day.
Yeah, we will. We'll send off your fun song to you by email. You can print it and frame it.
That was awesome. I loved it so much. I'll treasure it forever. Thank you.
Thank you for joining us. All right, let's go back to this and look at this. We're actually going to be able to go have lunch at a reasonable hour, folks. So here we go. We will close out today's meeting with the shower thought. No one will ever know what the world's best hiding spot is. There we go. You guys have a great week. We'll see you next week for the last meeting of September, our Rotarian of the month, and look forward to seeing you all then. Happy birthday again, Rosa and Gloria.
Thank you.
And Frank, thank you again for stopping in today, and Godspeed.
I will see you guys. Hey, Frank and Gloria. Godspeed.